A very good morning to all of you today. And it's a great pleasure to be here today with you to hand over the assortment of laboratory and hospital medical equipment and supplies to the Ministry of Health and Child Care. This handover is a demonstration of our strong collaboration between the government of Zimbabwe, the World Health Organization, and partners who are working in the country in different areas of the health sector. And we have various types of commodities that are outlined by the board chair. We have cholera commodities donated today, funded by the United Nations Central Emergency Fund, commonly referred to as CERF, including mainly water quality testing kits and consumables, clinical waste receptacles, color-coded bins, case management and infection prevention and control commodities such as medicines, personal protective equipment, like gloves and gumboots, cleaning and disinfection commodities like hand washing liquids, as well as non-food items like aqua tablets, tap buckets, and water storage containers. The cholera supplies are worth close to 130,000 US dollars, and most of it, 170,000 of it is coming from the CERF, while the remaining 15, almost close to 16,000 US dollars is coming from USAID. These are critical for managing cases at community level and facility level. Although we all know that cholera is declared over, but all the underlying facilitating factors are still prevalent. So this will help to boost the capacity of the country in preparing for a possible outbreak of cholera, and also managing other diarrheal diseases. The machines, the other component is, in addition to the cholera supplies, WHO is also donating 1.3 million US worth laboratory and imaging equipment funded through the African Development Bank. This equipment includes 2 ceiling-mounted digital X-ray machines worth about 793,000 or 794,000 US dollars, as well as chemistry analyzers and extraction machines and hematology machines worth 15,000 approximately US dollars. These machines and equipment will significantly improve the country's diagnosis ability in a wide range of conditions and diseases, including diabetes, kidney problem, and anemia, and more. They will also allow us to for a faster testing and better tracking of also outbreaks by actually enhancing the laboratory capacity at the same time. This equipment is a major boost in our health care system in Zimbabwe, which has been part of the ongoing support from African Development Bank to build back and strengthen the country's health system capacity following the devastating, pandemic, COVID-19. Furthermore, theater and surgical equipment was 237,000 approximately are donated through the support of the Japanese government, which is expected to significantly boost the country's capacity to provide essential surgical, obstetric and gynecology, life-saving services, surgical services that would save a lot of lives in areas where there was a challenge to provide such services. and at the same time also improving the quality of health care for countless individuals that will be benefiting through these provisions. This generous gifts aligns with our shared vision of a healthier and more resilient and equitable Zimbabwean healthcare system, as outlined in the National Surgical and Obstetrics and Anesthesia Strategy launched in 2022. Honorable Minister, ladies and gentlemen, Zimbabwe battled with cholera outbreak since February 2023, which has challenged the health system for some time, but we are thankful to all the efforts of our partners who came together to support the government of Zimbabwe to deal with this emergency, which finally enabled us to stop the outbreak and then calm down what's going on in the healthcare system. Now we focus on strengthening the other components of the health system to make sure that we have a better resilient system that will help us to detect and contain outbreaks in case they happen. We'll never say that it will never happen, but when it happens, we have to be ready. And all these equipments that we have, we are handing over today actually will strengthen the health system in different areas of healthcare delivery, and will strengthen our capacity to provide better care to the public. While outbreaks like cholera outbreak demand our immediate attention, it's crucial we do not lose sight of the bigger picture, building robust healthcare system prepared for all challenges. This cannot be achieved. Through short-term response alone. We must continue to leverage the power of collaboration. By working together, the government, healthcare professionals, international organizations, communities, all who have a stake in the healthcare system, we can build more resilient health systems that deliver quality care through strengthened healthcare infrastructure, addressing chronic diseases and ensuring also access to essential health services. Who is committed to continuously support the government of Zimbabwe in its endeavor and to also celebrate on a day of the country's effective containment of the cholera outbreak, which we have celebrated as set out in the National Cholera Elimination Plan, which aims to actually completely eliminate cholera. It's possible to eliminate cholera because most of the underlying factors are things that we can manage to change. It's possible. So we are hopeful that we will actually pursue strengthening the capacities at all sectors, particularly water, sanitation, hygiene component, to make sure that we never talk about cholera anymore in Zimbabwe in the future. But for that, we need the support of everybody. We applaud the work done so far and look forward to the ministry's continued leadership to make cholera history. We are also committed to support the implementation of the National Health Strategy, which is spanning between 2021 and 2025.
A very good morning to you all, and I would like to take this opportunity. It's my honor and privilege to stand before you today as we gather to witness a truly generous and impactful donation to our health sector. Today we celebrate the remarkable contribution made by our esteemed development partners. Your donation, covering several areas: cholera kits, essential medicines, medical sundries, X-ray machines, theater equipment, which is valued close to $1.8 million USD, represents not only a substantial investment into our healthcare infrastructure, but also a profound commitment to the well-being of the people of Zimbabwe. These vital resources will be stored, but just for a short while, at NatFarm. Our intention is to distribute them so that the people of Zimbabwe realize immediate benefit. I will assure you they will be utilized with utmost care and efficiency. The cholera kits and medicines will enhance our capacity to respond swiftly and effectively to any future outbreaks, while the advanced X-ray machines and theater equipment will significantly improve our diagnostic and treatment capabilities. Your support comes at a critical time and will have a lasting impact on our healthcare system. It strengthens our resolve to provide quality care to all Zimbabweans and reinforces our collective effort to improve outcomes across the nation. On behalf of the NatFarm board and the government of Zimbabwe, I extend our deepest gratitude to each and every one of you who has contributed to this generosity. Your generosity and partnership are truly appreciated, and we look forward to continuing our collaboration in pursuit of a healthier Zimbabwe. Thank you for your commitment and for standing with us as we work towards a brighter, healthier future for living, whilst in the process we are leaving no place and no one behind. Thank you very much. Please feel welcome at NatFarm.